Now, what are the symptoms of a support ligament injury? So again, if you went to Medscape, you can have all of these. You could have visual problems, balance problems. You could have pain going down your arm, headaches, ringing in the ears, migraines, dizziness, post-concussion syndrome. So you could have a lot more symptoms than just for a disc. So it's really simple. If you have more than pain down the middle of your back, more than pain going down arms and legs, you probably have more than a disc. So you need more than an MRI to diagnose it. So spinal support ligaments, when you injure them, destabilize the spine. So an injury can happen anywhere. It can happen from a car accident, can happen from a ski accident, from sports, from work. It doesn't matter. Very simple. Understand, diagnosing any of these injuries requires specialized imaging. Fracture, we're going to use a CT or an X-ray. All right. Herniated disc, we're going to use a MRI. How do we diagnose support ligament damage is detected by specialized X-ray procedure. Most doctors have these in their office. We're going to do flexion extension X-rays. So this is a picture of the neck. This is bending forward. This is bending back. Now look at this X-ray. This is really important. This is a open mouth bending. Now why is that important? It allows you to see the upper neck. Now you remember earlier when I said that the MRI of the neck doesn't look at the disc above C2. You know why? There is no disc above C2. So most MRI reports start at around C2. Between cervical 1 and cervical 2, there's no disc, there's ligaments. So if you have headaches, dizziness, and your MRI is clean, you really should get a motion X-ray, an open mouth X-ray. Now, the problem is most doctors are not going to have an idea to how to test that. So that's why you need to find a smart injury doctor in your area, okay? So what we're looking for is excessive translation, forward and back motion, or excessive angulation. And we can look for that for your neck or your back. This is someone bending forward, flexing forward, and this is someone leaning back. This is the head flexion forward, this is the head in extension. This is an open mouth. These are your teeth. These are your upper jaw. So we can see those vertebrae underneath your skull. And remember, there are tons of nerves up high on your neck. Those nerves control everything in the body. So the greatest density of nerves are in the upper cervical spine. So that's why you can have visual problems. That's why you can have headaches, dizziness, ear problems from an upper neck injury or an upper neck instability. And this is a report. Once we get a measurement of the spine, we can send these X-rays out to a company called Spinal Kinetics. And this is called a CRMA report, a computerized radiographic mensuration analysis report. This is a fantastic tool, and it's just like an MRI report of your spine. It's a excessive motion test. It's a support ligament test, and that report is very helpful for the treating physician. This is what an open mouth X-ray looks like. Now notice this red line. This is one edge of the vertebrae here. This is the other edge. If you notice this top vertebrae, that's C1. There are 7 cervical vertebrae in your neck, is overhanging C2. That tells us that very simply there's damage to the support ligaments of C1, C2. And that can cause horrific headaches, dizziness, balance problems. Again, MRI was never designed to detect excessive motion. And so here's an interesting research, chronic neck pain, making the connection between capsular ligament laxity and cervical instability. So these upper cervical instabilities can mimic mild traumatic brain injuries. So if you had all the problems associated with mild traumatic brain injuries, headaches, neck pain, dizziness, memory loss, typically you need to have an upper cervical spinal stability test. So find a smart injury doctor in your area and make sure that test was done. Remember, without the right diagnosis, you don't get the right treatment. Those ligament injuries are so severe that sometimes surgery is necessary. Now, in my clinic, we have a 95% success rate in stabilizing the spine without drugs or surgery, but sometimes surgery is necessary. And those ligament injuries are so severe that it qualifies someone to do surgery. So that's how severe it is. But most of the time, if you see a good provider, they can stabilize it without surgery.